You know, with the new school year upon us, it's the perfect time to ensure your child is healthy and ready to learn. Michelle Alvey and Tracy Mulder, they're physician's assistants with Trinity Health Medical Group, here today to share why now is a really great time to check in on your child's physical and emotional well-being and how your primary care provider can help set them up for a successful year. Thank you for being here, ladies. Appreciate it.
Thanks for having us.
Michelle, let's start with that physical. Pretty important stuff. Why is that?
Making sure that your child is growing appropriately, they're meeting the developmental marks that we are expecting. Sports physicals are super common this time of year too. They're required for athletic participation and in order to
even play.
Yes.
Right.
Yeah.
I mean, it's required for them, but shouldn't everyone do it? Because you want to make sure you're starting that year healthy, right?
100%.
And when it comes to us getting our kids ready, we always spend a lot of time with supplies. We have a lot of backpacks and books, but let's talk about getting their bodies ready. Sleep is a big deal, Tracy.
That is a huge important thing to discuss with the kids, limiting screen time before they go to sleep, getting 9 to 12 hours depending on their age, but it helps with their physical as well as emotional health.
Yeah, I tried not to laugh when you said 9 to 12 hours because trying to get kids to go to sleep over the summer is so hard. It really disrupts those sleep cycles. Let's talk a little bit about something that's really gained traction, and that is a focus on mental health. Your physical health and your mental health are combined. They are the same. Talk a little bit about how that's important as well.
Mental health is just as important as physical health. Making sure you're having open conversations with your kids, making sure that they can approach you about topics, establishing routines, getting good sleep, looking for signs that they might be struggling, changes in sleep, changes in eating, outbursts emotionally, changes in their attitude. For our older kids, you can see risky behaviors, things like that might give you signs that they're struggling, and either you need to have conversations with them or bring them to us so we can help you too. Absolutely,
and that's a lot of that is a transition. You know, sometimes it's just a transition from grade to grade. And you mentioned screen time. How can families manage that? Give me a rule that I can tell my kids.
Typically, we recommend less than 1 to 2 hours of screen time outside of what needed for schoolwork. Setting clear boundaries for what your expectations when children are on the screens are important, and checking in regularly with them, what they're looking at, what they're seeing, are they feeling threatened, coming to an adult when they are in those situations.
Well, take that time. Make sure that mental and physical well-being is taken care of. A school health kit could help. I mean, something small. What would you put in a school health kit?
Hand sanitizer, Kleenex, a reusable water bottle with a label on it so they know whose is whose.
Germs,
yep.
Right?
Any medications they might need. Typically to have that at school, though, you do need a doctor's note or provider's note saying that it's okay and when to take it.
Perfect. Well, thank you so much for the time and for helping us as parents get ready. TrinityHealthMI.org/primary care if you need any more information.